Hey guys, welcome to another episode of our coronavirus coverage. I am here with your favorite yums, Crystal and Carol. And we have with us a special guest, Cassandra, a very, very dear friend of mine who has worked in the nursing industry forever, like literally forever.
18 years. Yeah.
We met in high school and she was in the nursing program there. So not trying to give away my age or
I
her.
know, right?
We're going back here. And she's been working in rehabilitation centers that basically, I'd say, primarily have a population consisting of mostly elderly people. Am I right?
Yes.
So, yeah, Cassandra, let us know what this is looking like, this coronavirus. I mean, everyone's saying that, obviously the real threat is to the elderly. So I'm curious, and I'm sure everyone else is, as to how healthcare facilities are, attempting to keep them safe and stop the spread of coronavirus there.
Well, mainly you have to stop people from coming in and out of the facility and from patients going from, floor to floor or staff members from going to floor, especially if you have cases of people having temperatures and stuff. Like, I know one of the units is quarantined now at the facility that I was working at. So you just really have to keep it under control.
Sorry, my cursor.
It froze.
So basically, obviously every day we're being told more and more to stay home. Why is that so important? Like, what is really, I mean, obviously we're all hearing like through the media and news sources that this is like highly contagious. So, like, are they practicing social distancing within these facilities? Are they moving like beds further away from each other? I don't know. I'm imagining with social distancing.
No, I mean, I've been in touch. So I've actually been blessed to just start a new job a week before this kind of all really blew up. And, but I have been in touch with coworkers, and basically they are saying like one of the units that I normally work on is quarantined right now because they do have several patients that are experiencing elevated temperatures. So they have been tested, but as you may know, we don't get the results right away yet. Mm-hmm. So you really have to just take precaution with, you have to basically act like everybody may have it, even coworkers. I personally, if I was there, I'd be wearing a mask. I'd be obviously wearing gloves. Washing hands is like the main thing to do to prevent the spread of infection.
Right. So now.
So wait, what do you mean by quarantine? Like your coworkers can't leave? I'm sorry to cut you off, Crystal.
Well, they can leave once they're done with their shift, but while they are on their shift, everybody that is working on that unit has to stay on that unit, and other people from other units cannot come onto that unit, including patients, because we do have some patients that are more alert, that are able to go in and out the facility. So I know they have put a stop to that as well. So yeah, once a unit is quarantined, like whoever's on that unit has to stay on that unit and nobody else is allowed to come on.
Okay. Now, specifically, the elderly, since you work directly with them, why are they so at risk? I know we've heard different theories, but I want to get straight to the facts for those who are not taking it that seriously and are still maybe or possibly exposing their grandparents or those at that age group.
Right. Obviously, most elderly do have underlying conditions. Some may have cancer, diabetes, obesity. I mean, and that I feel like goes for any age group. I feel like every age group should be taking this very seriously. But as far as the elderly, their immune systems are already compromised and have to be very sensitive to that, especially like whether you work in a healthcare facility or if you're just dealing with your own family member, grandparents, or older, family member, you should take precaution. If you are going to visit somebody and check up on them, you should have a mask on. You should be washing your hands, before and after visiting people. And you should advise them that they should be staying, home and not be having, going anywhere or having visitors come in as well. Everybody who comes in contact with them should be wearing a mask at least to protect themselves and, and the elderly.
Right. So other than washing our hands, what other ways are you guys or your coworkers helping the elderly stay safe?
Well, it's really just wearing the protective gear that you should be wearing when you are coming in contact with somebody who may be exposed to this virus. It's really just being very careful and considerate of everything you do.
So to add to that, maybe specifically, so there's no interaction with their family. So at all these nursing homes, they're not allowed to see their loved ones. Is everything completely?
I'm not sure how, each facility may be run differently. I know they were trying to stop, visitors from coming in at this point, because it is vital to keep, less contact from coming in and exposing everybody, staff and patients.
I've actually been hearing really heartbreaking stories of like elderly people who are forced to like die alone because of this. Actually, someone we both know, Crystal, lost a grandparent, Stefan, his grandmother actually passed away a few days ago, and they weren't able to visit her because of all of this. Not even just, I guess, in like elderly homes, but like hospitals too are really like cracking down, on like this, the visitation policy.
And I feel like as time goes by, let's say by the end of next week, I feel like all of us will have known somebody that has known somebody who has contracted this virus, or directly may, God forbid, know somebody. So I feel like people need to really take this seriously. I feel like it's very important to be in quarantine at least for the next 2 weeks to 4 weeks, only because it's going to be at its peak right now. It's only going to get worse before it ever gets better. And if we don't contain it now, it's just going to keep, the process will go on longer, basically.
Right. Great point.
So you mentioned the whole interaction, and I know for me, my aunt is under 24-hour. She's at home, and I'm just scared to even go see her. No one, I have 2 kids, so I don't even know this whole like, oh, you might have it, you might be asymptomatic. So what advice do you have for families who do want to still keep in touch with elderly, with their relatives, whether they are in hospice or whether they are, how can we sort of still maintain that kind of, because I also feel like I don't want them to, there is an aspect of loneliness in all of this.
Yes.
That takes a mental health, it takes a mental toll. So kind of just maintaining them, just spiritually uplifted and us ourselves as well connected to them in a way. What advice do you have for?
I feel like the safest thing to do is obviously pick up the phone and call your loved ones. Constantly check up on them, especially the elderly. The other day, if I'm around my grandmother's neighborhood and I'm like, oh, let me stop and bring her coffee or something, like just little things like that. And I thought about it. I said, you know what? Let me not stop by right now. Like you have to really think to yourself, although you want to check up on your loved one, you don't want them to feel lonely. But the main thing is thinking about their health first, their safety. Obviously, you want them here with you. As far as like, if you have to get them groceries or something, like I tell my grandmother, don't go out. Make sure if you need anything, I'm here to get it for you. And if I do bring her anything, then I'll put a mask on. I just feel like be very, protect yourself, protect them. Obviously, check up on them. Make sure they have the supplies they need, the food they need, so that they don't have to go out. Because sometimes they are stubborn as well, I know my grandmother can be stubborn, and she's like, oh, no, but, I'm just going here. I'm like, no, don't even risk it. I will go for you,
Yeah, they're so stubborn. It's insane how at my age, I feel like I'm maintaining another teenager. Yeah, I'm like, are you another? My mom is like, oh, I'm just gonna go take a cab and visit like my sister. I'm like, no, like do not, like let us.
They don't want to lose their independence. They feel that they're already getting, they're elderly, but the fact that they're still able to walk around and fend for themselves, and then you're limiting them. They're like, nah, like I can still let me do this while I still can. So it's hard. It's a lot of mental issues, and maintenance that we need to help provide them, and even for ourselves. You know, we could be aggressive, we could be even mean in our delivery when we do speak with them because we're scared, but we don't want, you know, to damage their spirit. So I think we need to be mindful of that too.
Definitely.
So would you also say like we should refrain from like having, you know, grandchildren interact with the grandparents who might be elderly? Because you know, my son saw my parents the other day and he wanted to give my father a hug, and I was like, do not do it. And then it's like hard for him to process because he's like, why can't I hug him? Like, and it's just like a lot. But I mean, what I've been hearing is that a lot of times, especially in other countries where, you know, the virus has went rampant, like in Iran, where there's like multi-generational living, where grandparents and grandchildren, like who are kids, are living under the same roof. I was hearing, and I don't know how true this is, but that basically the kids were coming home and and not showing symptoms, but then infecting the grandparents, and then they'd be the ones dying, basically. So
yeah, and I feel like that is one of the main points to get across, especially maybe to the younger generations who may not be taking this as seriously. You may be asymptomatic, you may not show any symptoms, but you can carry it, and then somebody else whose immune system is suppressed will get it, and God forbid. You know, you want to prevent, first of all, who wants to catch this? I don't think anybody does, even if they say, oh, it's just flu-like symptoms. No. Second of all, it affects your respiratory system. I mean, I don't think anybody should take that lightly. And third of all, why would you want to end up, God forbid, in a hospital with pneumonia or something? They're already short-staffed as it is on a regular basis. They're already short supplies on a regular basis. This is not the time to want to end up in a hospital, honestly speaking.
That's a great point to end on. Yeah.
Wow. Yeah, I was just gonna ask you that. Like,
yeah, I was gonna ask, like, what is it? If you could break down what it means to be asymptomatic, because I don't think, you know, you kind of, it's all over the news now, but I don't think people realize like what exactly does it mean? Does it mean you, if you feel a little kind of trickle in your throat, you might have, like, what exactly?
Right. Sometimes some people may have mild symptoms. I mean, we're in flu season as it is right now. You know, the regular flu, and, you know, allergy season is now, you know, there's so many different things you can confuse with other symptoms, you know, with other sicknesses, you know. So I just feel like, one, if you do feel any type of symptom, you should make it everybody who you're around aware, because that's your responsibility, as, you know, not wanting to pass it on to anybody else. And you may feel fine, you know, apparently, you know, sometimes if you are younger or healthier, you may feel okay. I know one of the basketball players said he didn't feel any symptoms. He felt like he could play basketball, but he came out positive for the virus. So I feel like we should all just take precaution and act as if everybody can possibly.
Right.
I think that's the safest way to go about it.
Well, thank you so much for sharing your insight, and I guess the real takeaway here is stay away from the elderly if you can, because we don't want to, you know, infect them and end up losing them. So
yeah, absolutely.
Well,
thank you so much for having me, ladies.
Yes,
thanks, honey. It's good seeing you
again soon.
Don't go too crazy at home.
We are.
Trust me, I know.